Dr. House is always talking about bizarre, weird, rare, crazy medical conditions. But is his diagnosis accurate? Let's react.
These were your brain waves at 2:45 a.m. Here it comes. There's an abrupt jump from slow wave sleep. This indicates partial sleep arousal. The most common type is somnambulism, sleepwalking.
That would explain why I'm so tired when I wake up.
Yes, and also why you were pregnant. And the hickeys.
I had sex in my sleep.
Sexsomnia is a documented disorder. You said your ex lives downstairs.
I'll kill him.
Disorders of arousal are a complex array of different sleep disorders that occur during slow wave sleep during the first third of the initial deep sleep period. Typical behaviors are confusional arousal or sleep drunkenness, exhibited by confused type behavior, sleep terrors, where a patient can sit straight up in bed and oftentimes scream, somnambulism or sleepwalking, and sleep-related abnormal sex behavior or sex somnia or sleep sex.
I'm going to write you a prescription for a low-dose antidepressant. It'll let you sleep better. If you want to save yourself the $15 copay, you could have sex while you're awake.
Sexsomnia isn't that common. It's reported in about 1 out of 100 patients who present to a sleep clinic for these types of disorders. Patients also typically have other sleep conditions like sleep apnea, and treating that comorbid condition and resolving sleep apnea oftentimes resolves the sexsomnia as well.
That's what made this thing rear its ugly head.
What thing?
B12 deficiency.
Are you having deja vu? We've had this conversation. She was given B12. She didn't get better.
Because someone else ate it. Get an abdominal MRI.
What? What are you doing? Don't touch me!
See? There she goes.
Don't touch me!
Paranoid delusion.
Most commonly ascribed symptoms for B12 deficiency are anemia, fatigue, headaches. There can be many different medical conditions which can also cause those symptoms, but it's certainly an easy thing to check, easy thing to resolve by taking B12 supplementation. In rare cases, there can be systemic side effects, central nervous system side effects, confusion, numbness, muscle weakness, indigestion, diarrhea. Apparently they have the diagnosis, they've done lab tests, they found that she's vitamin B deficient. Apparently they've supplemented vitamin B12, but she's not getting better. House said somebody ate it. I don't know why somebody would take your vitamin B12.
All right, we need an OR.
Leave me alone! Occupied!
Her hernia can wait.
Help! They're trying to kill me!
Okay, you can either believe that we really are trying to kill her.
Okay, so in no universe do you have a surgery that's currently underway and it's permissible to roll another patient into the OR that's already occupied, that the entire surgery room has been sterilized. Bringing another patient contaminates the whole sterile setup that you have in that room, and you can't sterilize the room again for the patient that you're about to operate on, so you've just basically ruined their surgery and your surgery. So this is not a really plausible scenario here.
I'm gonna need iodine, scalpel numbers 10 and 15, forceps, and a largish salad bowl.
Yeah, he didn't scrub in, hasn't prepped the patient, so this is not going too accurately from a surgical standpoint here.
Okay, hold her down. Come on, weenie, she's in a cast. Swap.
Okay, well, they did prep at least.
15.
You're not going to anesthetize her?
Relax, it's just a magic trick. She's faking it. We're not falling for it this time.
Yeah, I know. I'm lost here. Oh, okay. There's a tapeworm.
Lake fishing can be fun.
That's really disgusting.
Giving room and board to this fella. By free board,
So that's where the
all
vitamin
B12
B12 is
take in.
going. Yeah, I'm not sure why you don't have to anesthetize a patient before cutting into their stomach to remove the tapeworm. And he wasn't wearing a mask the whole time either. So you typically acquire a tapeworm from eating undercooked meat or fish. Most are asymptomatic, so the diagnosis, patients get epigastric pain. They can actually have the sensation of movement around their bum, have indigestion. Sometimes the worms can affect their appendix, gallbladder, pancreas, and they can get diseases in those organs. Otherwise, they can have weight loss, and in this case, vitamin B12 deficiency. The diagnosis is made by a stool culture, and the treatment is a drug called praziquantel, or surgical resection, as they gloriously demonstrated in this video. Just next time, house, go ahead and schedule an OR. This is an emergency. You can get in there, put the patient to sleep, and we can take the tapeworm out under more controlled circumstances. So I'm going to leave house with a 6 out of 10. So the disease conditions, the sex, somnia, and tapeworm is pretty cleverly crafted. The management of the tapeworm, that left a little bit to be desired, as we discussed. Extracting a tapeworm, really difficult. Hitting that subscribe button, very easy. I'd take the latter. We'll see you guys next time.